Welcome to DoodleMed Insights.
Anemia of chronic disease is a type of anemia that occurs as a result of underlying chronic conditions, such as infections, inflammatory diseases, or cancers. It is characterized by decreased red blood cell production and impaired iron metabolism, often leading to low levels of hemoglobin and smaller red blood cells. Anemia can happen with almost any long-lasting inflammation, infection, or cancer. One key player is hepcidin, which controls how iron is used in the body. When hepcidin levels are too high, like during inflammation, iron gets stuck in certain cells and can't absorb well from the gut. As a result, there is not enough iron available in the blood for making new red blood cells, leading to anemia. Hepcidin is a protein that stops the movement of iron by latching onto a channel called ferroportin, found on the surfaces of certain cells like gut enterocytes and macrophages. When hepcidin binds to ferroportin, it blocks the export of iron, trapping it within the cells. This action limits the amount of iron absorbed from the diet by preventing its release into the bloodstream via enterocytes. Furthermore, hepcidin reduces the release of iron from macrophages by inhibiting ferroportin activity. In genetic condition where hepcidin levels are too low, such as in hemochromatosis, excessive iron absorption can happen due to unchecked iron movement through ferroportin. Clinical features of anemia of chronic disease. Fatigue, feeling unusually tired or weak, even with normal activities. Pale skin, reduced red blood cells can lead to paleness in the skin, lips, and nail beds. Shortness of breath, difficulty breathing, especially during exertion due to decreased oxygen carrying capacity of the blood. Weakness, generalized weakness, and decreased stamina. Increased heart rate, the heart may need to work harder to compensate for the reduced oxygen supply, leading to a faster heart rate. Dizziness or lightheadedness, feeling faint or dizzy, especially when standing up quickly. The serum ferritin level is within the normal range or elevated. However, the serum iron level, transferrin saturation, total iron binding capacity, and MCV are all low. Additionally, the reticulocyte count shows a decrease. Furthermore, the red blood cell morphology indicates normochromic and normocytic characteristics. Treatment involves first treating the underlying disease. If we don't know the underlying disease or if treating it doesn't help the anemia. Assess erythropoietin levels. If low, consider administering erythropoietin or erythropoiesis-stimulating agents, but make sure there's enough iron in the body first because low iron can make these medicines less effective. If erythropoietin levels are normal, packed red blood cells can be administered as needed.
Thank you for your attention, and I hope you have gained valuable insight into this important topic.